AI and medicine is like a weather forecast. It can be incredibly useful, but it's still a prediction built from the data it was given. AI is coming into medicine fast. And let me be clear from the beginning. I'm not anti-AI. AI can be an incredible medical tool. It can organize information. It can summarize research. It can help identify patterns. It can support documentation. It can compare data. It can help clinicians think through possibilities. It can help patients learn basic concepts. It can reduce administrative burden. It can help medicine move faster. But AI is not the end-all be-all. AI is not a doctor. AI is not wisdom. It is not context. And AI is not clinical judgment. AI is a tool, and tools are only as good as the person using them, and the data feeding them, and the question being asked. Think about the weather. We use weather models all the time. They're very powerful. They pull satellite data, radar, temperature, humidity, pressure, wind patterns, storm movements, historical trends, and massive computational models. And yet, how many times you looked at the forecast and it said 0% chance of rain, then 20 minutes later, you're standing in a parking lot and getting destroyed by a thunderstorm? Why does that happen? Because the model is not reality. The model is an interpretation of the data. If the data is incomplete, the prediction can be wrong. If the local conditions change, the prediction can be wrong. If the model weighs the wrong variables too heavy, the prediction can be wrong. If the environment shifts faster than expected, the prediction again can be wrong. That doesn't mean weather forecasting is useless. It means the forecast should inform your decision, not replace your awareness. Medicine is the same way. AI can take the data you give it and generate an answer. But what if the data is incomplete? What if the person left something out? What if the lab was drawn at the wrong time? What if the symptom history is inaccurate? What if the patient or person has sleep apnea? What if the person has trauma, stress, medication effects, insulin resistance, nutrient deficiencies, autoimmune disease, mold exposure, infection history, or hormonal changes that were never entered? What if the AI sees the numbers but misses the human context? Change the data, you change the answer. Change the context, you change the interpretation. Change the question, you change the conclusion. That is why data alone is not medicine. Data needs context. A fasting glucose of 94 may look normal, but what if fasting insulin is high? And A1C may look fine, but what if the patient's already compensating with insulin resistance? A TSH may be in range, but what if the patient already has thyroid antibodies and low T3, postpartum onset or fatigue and hair loss and cold intolerance? A cortisol test may look very interesting, but what if the patient only slept 3 hours, drinks caffeine, trained hard, and took the test at the wrong time? A genetic test may show a variant, but what if the variant does not match the patient's symptoms, family history, labs, or actual risk? This is the danger of AI medicine. AI can make incomplete data sound complete. It can make uncertainties sound confident. It can make pattern recognition look easy. It can give an answer before the right question has even been asked. And patients are vulnerable to that, because when someone feels sick, tired, inflamed, dismissed, overweight, anxious, foggy, or desperate, they want answers. AI can give answers quickly, but Quick is not the same as correct. Confident is not the same as wise. And personalized wording is not the same as personalized medicine. This matters tremendously in peptide medicine because peptide medicine is already very complex. People ask, what peptide should I take for fatigue? What peptide should I take for inflammation? What peptide should I take for weight loss? What peptide should I take for injury? What peptide should I take for brain fog? And AI can generate something that sounds very impressive. It may list a whole bunch of peptides. It can describe mechanisms. It can explain pathways. It may sound educated, but the AI doesn't know the patient or the person's pattern. It's just guessing. Fatigue can be sleep apnea, iron deficiency, insulin resistance, thyroid disease, medication effects, depression, inflammation, overtraining, undereating, low protein intake, chronic infection, hormonal balance, or something even more serious. Brain fog could be glucose instability, poor sleep, B12 deficiency, neuroinflammation, stress load, medication effects, autoimmunity, head injury, or vascular disease. Pain can be tissue injury, inflammation, nerve irritation, autoimmune disease, poor load tolerance, joint instability, or a red flag pathology. So, if AI gives a peptide answer without a patient pattern, that's not clinical reasoning. That's automated symptom matching. And automated symptom matching is still symptom matching. At Praxis Peptide Institute, we teach the opposite. Pattern first, then signal, then system, then evidence, then risk, then monitoring, and finally decision. AI can help with that process, but it cannot replace that process. Used well, AI can help organize a patient's timeline. It can help summarize labs. It can help generate questions for a clinician. It can help explain mechanism in plain language. It can help patients prepare better for visits. It can help clinicians review possibilities they may have not even considered. It could help track response over time. That is the good side. But used poorly, AI can make people more reckless. It can encourage self-diagnosis. It can create anxiety. It can overinterpret weak data. It can hallucinate confidence. It can turn a symptom into a protocol. It can make a patient think that they have an answer when they only have a prediction. That's the difference between a tool and a mastery. AI should serve clinical reasoning. It should not replace clinical reasoning. Because medicine's not just data. Medicine is context. The patient's history, timeline, symptoms, labs, medications, family history, stress, sleep, environment, nutrition, training, trauma, risk factors, goals, any red flags, and response to prior treatments, just to name some of them. And the clinician's ability to interpret all that inside of a living human being. The weather model, again, cannot feel the wind on your face, and AI cannot examine the patient in front of you. It can help forecast, it can help organize, it can help suggest, but it cannot replace awareness. So the future of medicine should not be anti-AI. That'd be foolish. But it should not worship AI. That would be dangerous. The future should be AI plus clinical reasoning, AI plus human context, AI plus patient safety, AI plus humility, AI plus better questions. Because the real danger is not AI itself. The danger is people using AI to create certainty when uncertainty still exists. That is why Praxis Peptide Institute teaches systems thinking. Not because technology is bad, but because technology without context can become another form of shallow medicine. The patient is not the data. The patient is a system. And if you change the data, you change the AI. But if you understand the system, You can ask better questions. That is the future. Not AI replacing medicine. AI helping medicine think better. If we are wise enough to keep context in control.